Hello, this is Ralph Fernari, and I'm your instructor for HM 2010. This is week 4, and our discussion this week is about assessing managed care contracts. The discussion starts out with the physician asking you to review a Cigna agreement that he received in the mail. The thing to remember about evaluating managed care contracts for your practice is, at the end of the day, is this a good thing for the business of the practice? It's likely that it would throw more volume at the practice, more patients, but there is many a situation where a practice took on a managed care contract where they did get more patients, but the reimbursement per patient was so low that they lost money on those agreements. Your text discusses the elements of a managed care contract between pages 54 and 58. And so I suggest that you take a look at that before you even enter into this discussion. You should be able to pick up a few key points as to what you're going to look for in those agreements. And I think that just like some of our previous discussions, if all of you pick out a few points, we can have a lively discussion about really what's the best way to evaluate that agreement. I think one of the key things to remember is your reimbursement rate. Also, is there a promise of volume? And finally, do you have an exclusive arrangement so that you would get the lives in that area? Managed care has changed over the years. Most managed care companies will not deal with individual physicians, as this discussion is suggesting. And most of the time they go through group entities like PHOs, physician hospital organizations, and now, of course, ACOs as well. So take a look at the text and then jump into the discussion as to how you would evaluate that agreement. Thanks very much.